N-acetylcysteine is a powerful supplement, but most people don't know what to use it for and how to use it. So in this video, I'm going to talk about all the important facts you need to know about N-acetylcysteine. Some people refer to it as NAC. N-acetylcysteine is actually a very potent antioxidant in the body, and it neutralizes harmful free radicals that can damage your cells. Also, it's very important because it increases the body's glutathione levels, which are possibly the most powerful antioxidant in the body. N-acetylcysteine is used to support liver and kidney detoxification, and we use it to support immunity. Now, hospitals actually use N-acetylcysteine, and it has very specific uses. And this shows the power behind the science of it. NAC is given to patients who have an overdose on acetaminophen to prevent damage to the liver or liver toxicity. In addition, it's used orally and by nebulization, where you breathe it in, to reduce mucus thickness and promote drainage in the respiratory system. But in holistic medicine, we use N-acetylcysteine for many different reasons. Number one, we use it for upper respiratory problems, as well as the lungs. So we use it a lot for sinusitis, bronchitis, pneumonia, because it has unique property of breaking up mucus, and then it thins the mucus so that your body can drain it better. You can get it out of your sinus, you can get it out of your lungs. As well, NAC is an anti-inflammatory, so it has anti-inflammatory effects on the body, including the respiratory system. So often I'll use it for patients who have bronchitis, pneumonia, chronic obstructive pulmonary disease known as COPD, sinusitis, or any condition where mucus is a problem in the respiratory system. This includes people who have postnasal drip. You wake up and you're coughing in the morning because you have postnasal drip during the night. And so there's different doses you can use for NAC. Most people use between 600 to 1200 milligrams per day, but you can use up to 4,000 milligrams in people with chronic bronchitis or COPD to get a more powerful effect for these conditions. Also, I do like to use it as a breathing treatment, a nebulized treatment. And so it works good for people who, again, have the bronchitis, they have the pneumonia, they have the sinusitis, because you can thin that mucus so that it can be drained, and NAC needs to be prescribed by a doctor. Now, in terms of the immune system, as we're getting into the fall and winter, NAC is great for immune function. It's been shown in studies to improve natural killer cells. These, like Navy SEALs, will go around through your bloodstream and kill bad bugs, viruses, bacteria, fungi, even cancer cells. And so we know that only 25% of people who were given NAC for a period of 6 months got the flu when they're taking it for immune protection, versus 79% who took a placebo in one study. Also, NAC is a great supplement to improve liver function. Why? Because it's anti-inflammatory, it's an antioxidant, and it enhances glutathione. So it helps to support your detox pathways. As well, it can help with fatty liver and liver accumulation that occurs so commonly in Americans. Now let's look at it for kidney protection. It's one of the few agents shown to protect against kidney injury from contrast dyes used in imaging. And so the protective effects are thought to be to its antioxidant and vasodilating actions, improving blood flow through the kidneys. As well, it's been shown in some studies to prevent apoptosis or kidney cell death. And so studies have been somewhat mixed on the benefit of NAC preventing kidney injury from contrast dye. However, there was a study published in the Journal of the American Heart Association, and they reported that NAC supplementation was shown to be associated with a significant decrease in kidney injury from contrast dye. So this is good news. And the dosages used in this meta-analysis varied greatly. I normally have people take 600 to 1,000 milligrams a few hours before their contrast dye study, and another 600 to 1,000 milligrams afterwards to support that kidney detoxification. Now, NACs also help with mood disorders. It's had studies in journals like Neuroscience and Behavioral Reviews. And the researchers summarized their findings by saying, quote, "We find favorable evidence for the use of NAC in several psychiatric and neurological disorders, particularly autism, Alzheimer's disease, cocaine and cannabis addiction, bipolar disorder, depression, conditions where people are pulling their hair known as trichotillomania, nail biting, skin pricking, OCD, schizophrenia, people get drug-induced neuropathy or nerve damage, and progressive myoclonic epilepsy." So a lot of different uses for it in that sphere. And again, they note that it's very safe in terms of its tolerance. Now, also, it has a balancing effect on the neurotransmitter known as glutamate, which is an excitatory neurotransmitter. And so it also has been shown to help with dopamine balance, because dopamine, when it's imbalanced, can cause low motivation and depression. So now most people, a typical dose would be 1,000 milligrams to 1,200 500 milligrams 1 to 2 times daily, and it's best taken on an empty stomach. People who are on psychiatric medication should obviously check with their doctor first before using it. But overall, NAC is a very safe supplement to use, and the average person will do very well with it. Well, I hope you found this video effective. Now you know how to use NAC for different conditions and the doses. And if you want to find more videos in terms of detoxification, helping your immune system, the best supplements with the best studies, look for more videos on my YouTube channel.